on tonight's programme. The BBC learns of significant cost-cutting plans that could affect NHS services across England. Good evening and welcome to the BBC News at 6. Now, NHS services across England could be cut as part of wide-ranging efficiency plans seen by the BBC. The proposals include ward closures in some areas, cuts to bed numbers and changes to accident and emergency departments. NHS England needs to save £22 billion by the end of 2020 and says local people will be consulted on the plans. Well, our health editor Hugh Pym is in Leeds for us tonight. Hugh.
Yes, Clive, here in West Yorkshire and in communities around England, a lot of debate's been going on about how the NHS might look like in the future. Now, it's been going on under the radar until now, but it really seems to add up to something very significant. NHS managers say it's simply about making better use of NHS money at a time of increasing pressures. But local campaigners say it's really a licence to make cuts, which will inevitably affect patients and services. It's a process which could result in a radical shake-up of health and social care services in some areas of England, with possible closures of A&E units, hospital buildings and a review of GP services.
Well, it looks like quite a lot of these plans at the moment are proposing big, large-scale reconfigurations. That's shifting services or shutting services down, providing them elsewhere.
Here in Leeds, plans have been drawn up for the possible closure of some wards across several hospital sites in the city.
Government officials who have their hand in the NHS pockets, they should get the cuts, not the doctors, nurses, patients, everyone who uses and works on the NHS on the front lines.
The population's growing, so how can you make cuts when there's more demand?
In nearby Huddersfield, the local A&E is already earmarked for closure.
The view is that care will suffer.
Campaigners who've been fighting that decision are concerned by the latest news of a wider local reorganisation.
Everything seems to be done piecemeal and there doesn't seem to be an overarching plan that puts patients and the public at the centre. I think there needs to be a huge debate about the NHS.
Other plans include Leicester, Leicestershire and Rutland, with proposals to reduce 3 general hospitals to 2, the Black Country area of the West Midlands with a plan to close an A&E unit, and in Cornwall there's a plan to move resources from hospital care into the community. Here in West Yorkshire and around the country, the word from NHS England is that local health and council leaders will work together to decide the best use of resources to meet the increasing demand for patient care. The background to all this is the need for efficiency savings to help make the NHS's finances add up. NHS leaders say it's not about cuts for the sake of it, but how to meet the needs of a growing and ageing population.
With that demand comes rising costs, and we're not trying to say, well, the simple answer is to just slash and burn and close services, but in fact we need to think about how we deliver services and what tends to drive up those costs.
And then Cordian just 30.
NHS England says no plans have been finalised. When they're published in October, there will be a chance for local people to have their say. Judging by today's exchanges, stand by for a heated debate about the future shape of the NHS. Now, if you talk to senior people at the top of NHS England, they say this is a really important process for the NHS. They have to find these £22 billion of annual efficiency savings by 2020, and this exercise is what that's all about, finding how to make the money go further. But it's going to be a hard sell. Local patient groups and others will undoubtedly oppose closures in their local areas, and some will be arguing tonight, I think, that what the NHS really needs is more money.
OK, Hugh, thanks for that. Hugh Pym there, live in Leeds.